complementary therapy is therapy that works alongside conventional medicine, such as meditation, massage, aromatherapy. It's not instead of, and that's a very important point to make. It complements mainstream medicine. The complementary therapies offered by the Malta Hospice movement are massage, aromatherapy, reflexology. I also do some imaginary as well with patients. They're referred to me through the key worker normally, and then I make contact with the patient, and I'll go and discuss, and we will offer 6 sessions free of charge, and we will sort out the protocol and the way to do it around the patient's medical appointments. So aromatherapy is the use of essential oils, which are oils distilled from plants, shrubs, twigs and trees, and petals, and they carry properties when they're distilled. So you'll be using these oils in certain concentrations to help, for example, they carry properties like anti-inflammatory properties, calming properties. So you would look at them to help perhaps with pain, analgesic properties, an oil with analgesic properties. So you'll be using them, looking at these things. So to help with pain, to help with inflammation, to help with anxiety. Massage is hands-on, basically, where you might apply the aromatherapy oils. You might not, you might just use a carrier oil, and you might use the massage to help relieve stiffness, pain, help with even with constipation if it's on the abdomen, or lymphedema or neuropathy, depending what the person needs at that time. Reflexology is different altogether. Reflexology is a specialized treatment on the hands or the feet, where the nerve endings of all the tissues and the organs of the body are mirrored in the hands and the feet. And it starts with a general massage, and then it's a walking movement over the hands of the feet. And this I have found to be extremely helpful, especially for physical symptoms such as constipation, but it's also very relaxing. All the therapies are very relaxing. They release endorphins within the body and enkephalines, which are the body's natural feel-good hormones. So this is why they're used. And they're a multitude of benefits, and every treatment is tailor-made for that specific person. So I might have someone with the same problem but use a different therapy. It will all depend on the individual. This service is offered to all our patients, whether they've got cancer, ALS, motor neuron disease, heart disease, kidney disease, pulmonary fibrosis. All our patients across the board are able to access it, as long as they're a patient of Hospice Malta. They can definitely be psychological, because if I'm using aromatherapy, for example, and someone's just a low mood, I would use an uplifting oil to help lift their mood and their spirits. Even I might use oils on a tissue or a hanky to help them with their anxieties, advise them going to have treatment, for example, where they get very anxious. Or I might mix up some in an aroma stick for them to inhale to stop them being so anxious at the time. When I first started, which I started many years ago, I had 7 patients. Now I have nearly 100 a year, so that's really grown, and there's only me, so obviously it's limited, but all patients can make use of the service if they feel they would like to. And often some patients, they request something, they don't want to take any more pills. Can you help me? I'm having insomnia, I don't want to take any more pills, or the back pain is bothering me, I would like it massaged. I've also, in times of COVID at the moment, I'm also making up blends and delivering them to homes of patients, and I've produced a booklet for carers, so the carers will know that they can give a massage safely and how to do it and how to position the person, etc., to try and get through these difficult times. I work as part of the team and we'll work together, so I know a lot about the patient before I even see him for the first time, and any issues I can discuss with the key worker, or she can give me her feedback. So we work together very closely for the benefit of the person accessing the service. Obviously, my training has qualified me in this particular area. I've done quite a lot of training in the UK at Marie Curie Hospice, at Christie's Oncology Hospital, at St Christopher's and various places. So I'm alerted to the red flags as such. If I go to a patient and I can spot a DVT, or if they've got hypocalcemia, which is high calcium in their blood, or in a medical emergency. So those I will be aware of. Also, I'm aware of the safety of the oils through my training, and the safety, what would be safe practice and what wouldn't with a person with the illness. So I need to know I need to know about the illness, but also about the treatments and what the side effects might be and what potentially wouldn't work and what would work. So that's come within my training. But if I'm ever concerned about what a patient wants and I'm a bit concerned about it, I will not hesitate to contact one of our doctors if they're involved in the case, or discuss with the oncologist. Complementary therapies are often offered throughout the UK in various hospitals, in all hospices I have visited. So it's a common practice, and it's found to be very helpful. The proof is in the pudding as such. If you're going to use complementary therapies yourself and you have a serious illness or disease, always be aware that the therapist is properly qualified in coping with that illness or disease, because you do get random people out there that will do things that are not appropriate, sadly. So when someone's referred through hospice to me, it's normally a referral from the key worker, and that could be anybody. It could be the nurse, it could be the doctor, it could be the social worker, it could be the psychologist, it could be anyone. And so I have a specific referral form. I will make contact with the patient, and normally I will go, in non-COVID times, let's say this, I will go home and do a home visit and do an assessment, because everybody's an individual and every treatment is tailor-made for that particular individual. It's not this person's got breast cancer, so breast cancer, I'll do this, or colon cancers, I'll do that, or ALS, I'll do this. It's an individual. So I will go home and I will learn a lot about this patient by going home, about where they live, their lifestyle. There's a lot to know, because it's treating the person holistically. So I'm treating the whole person, not just the illness or the disease. So I will go home and do my own assessment, and then I want to involve them. I want them to make the decision. What therapy do they think they would prefer? And what is their problem? I might go in thinking their problem is this, and their problem for them is something else. So I will go through them, I'll get them to tell me about themselves and what's been happening to them, and about their whole lifestyle, their diet, what they're doing with their life, so I get a really good picture of them. And we will discuss what therapies they would like after I've explained them to them, and where they would like to have the therapy. Do they want me to go home and do a home visit? Do they want to come to hospice? Are they in hospital or in some other organisation? So it'll be all taken from there, and we will start the sessions the next time. If it's a home visit, I will go and I will see how we set everything up. So when I actually go to do the session, it's easy. I just go in and can do the session. Also, I feel it's very important with body work that they know me first. You just don't go in and invade someone's space. They need to know you a bit first, and I think that connection is important. COVID obviously has had its effect. I'm hands-on, so that is very difficult. When we're not able to do visits, as I say, I'm mixing blends. I'm keeping contact with patients and mixing blends that I know could help the patients, guiding the carers to do my job for me, basically, if they can, how they can, and when they can, and getting things out to patients. As visits, when we can visit, obviously I'm going through lots of COVID protocols, asking questions before I visit. I cannot socially distance. With reflexology, I can. That's fine because it's on the feet, so I am social. Massage is a bit difficult, but normally, for example, if I'm doing back massage, the person's faced away from me anyway, and they're faced away from me. I am extremely careful, wearing full PPEs, and that's how we go about it as safely as possible, using all the hygiene methods possible, and being extremely careful. Just before COVID struck, we did start offering complementary therapy for carers, because people caring for patients get very stressed, it's very stressful. So we started offering, we had 2 great volunteers who would come in and I would oversee to offer complementary therapy to the carers that are looking after the patients. Obviously that at the moment is on hold, but however, going into the future, I would like to see the complementary therapy sort of department at hospice grow, and obviously with an inpatient unit, it would be a lot easier. You've got patients, you're not travelling all the time to patients' home. You would see quite a few people in the actual unit. So yes, it would be nice to see it grow and expand. That's what I'd like to see.